Salivary glands. Now, there are paired salivary glands. That's the parotid, sublingual, and submandibular. It will be here. Like submandibular, usually you cannot palpate until it is infected, or some calculus in this your duct. Parotid, the masseter muscles are there here. Actually, when you dissect, you will see. I will show you the parotid in the histology lab. Now, what is the thing is that now the glands. Now, gland is a specialized group of cells that synthesize, secrete substances and hormones. Gland is a specialized group of cells that synthesize and secrete substances and hormones. Glands are deprived of epithelium. Derived, sorry, not deprived. Glands are derived from epithelium. Mucus is a noun and mucus is an adjective. For example, mucous cells secrete mucus. Mucous cells, MOCUS cells secrete mucus. Mucous cells secrete mucus. Okay. Now, now this is the look into the embryology. This is the surface epithelium, pre-bud stage. This is the bud, pseudoglandular stage, canalicular stage, terminal bud stage. Now, a portion of this is taken, a small piece of tissue. I had drawn a block. This is the wax. Now, tissue is such small, or it can be small. See, any under endoscopy, you go for gastric. You see upper GI endoscopy, upper gastrointestinal endoscopy. You can take a tissue from the esophagus in the area of lesion. It can be a gastric ulcer or suspicious. Then you take with the endoscope. It has a small thin probe, and you clip, small bits. But that gives. Now, this portion, what it does, it indicate, see this portion of the tissue from the gland is taken for histology. And what picture you see is this. Get it? Now, now you see the striated ducts, intercalated duct, myoepithelial cells, serous cells, and mucous cells. Now, what we will see development of excreting gland, salivary gland. Now, these are the surface epithelium. You see capillaries, development of the intercalated. Today's we are not just telling you this much. Now, you will go and see for yourself. Now, classification of glands based on number of cells. Now, unicellular, they have single cells to perform secretory function. Multicellular glands, they have groups of cells. Based on presence of duct, exocrine glands, they use duct to convey their secretion. The parotid, the sublingual, the submandibular, these are having ducts to give this secretion, salivary secretion. And the specific point. Now, endocrine glands, they do not have ducts and secrete secretion directly into the blood. That goes accordingly to the different cells. Now, based on manner of secretion. Now, these are the way how it secretes, that's manner of secretion. Now, you have to know this basic classification. You might have it an MCQ question or a short note. Now, now you see merocrine glands, they secrete by exostosis. Apocrine gland, they secrete by shedding of apical portion of the gland, and holocrine gland, they secrete by disintegration of the entire cell. Now, now this is you have it in your book, huh? But if you want it, lekha pada, if you want it, you can just write unicellular. Now this is the flow chart, glands based on number of cells, unicellular, multicellular, presence of duct, exocrine duct, endocrine without duct, manner of secretion, merocrine, exostasis, apocrine part of cell, and holocrine entire cell. Now this is a picture of a sebaceous gland. When you saw the skin slides, and you will see that this picture. Now there are paired glands, and there are some glands that is in the 10% in the mucous membrane of your palate, tongue, and the whole of the oral region, larynx, pharynx, the oropharyngeal opening. These are the things that is secretions are there, because the function of the salivary glands is to take the food and then it goes down into your stomach, esophagus, and everything. Now, your functional, your embryological, and this thing, now you have to see the histology. Okay. How many of you brought histology book? Kar histology boy enecho? Lift up, raise your hands. Suncho na kotha. Anupam, niye. Why? At this age, I am carrying a bag. Please see. I am just, if you want to study or not, I won't be responsible, because this is going on camera. But what I'm asking, that's going on this thing. So if your parents come and tell, they don't know, beta ne bahut kab padta hai, lekin thik tak idea nahi hota, then if I am called for in the guardians meet, I will tell, please see the video clipping. Jitna mera soch hai, jitna mera experience hai, I am trying to give it to you. I might be wrong at places, you correct me. I'll be the happiest person that day. Don't hesitate. If I'm wrong, you come and say, no, sir, you're wrong. If you want attendance, I will give attendance. From there, you go home. Don't. This is just your, how many days you have come? How many days? Ashun. কোথায় ই হাটে শাড়ি দেখছিলে? হ্যাঁ? শোনো, if you go on giving excuses, it will be bad. I told you earlier in the classes that don't skip class, don't bunk class, of course, don't sleep up to 4 a.m. and then come, biochemistry miss ho gaya, anatomy miss ho gaya, aap practicals mein aate hain. See, you are the blessed persons to come to study medicine. No one gets an opportunity. Tankard aayega bhi phir bhi opportunity nahi milta hai. And even there is very good students who they have no funding, they cannot come and join. You are the most privileged and blessed, I'm saying blessed by God, to explore into the world of medicine. I am a very emotional person. And today EQ is being rated more than IQ. I'm telling you basic one thing. Last Friday, I had performed an operation for 3.5 hours of the filarial penis and scrotum. The patient showed me in October 29th, and then he went to Bangalore. Few of his friends and relatives tell, "Chal Bangalore chal." In Bolpur, few surgeons said, "No, this 8 years back, for more than 10, 12 years, he's carrying a load up to here." And his urethral opening, the external urethral meatus in the penis, even you cannot find where it is. I took it as a challenge. In Manipal, they said you take medicine. See, you cannot cure many things. You cannot, but you diagnose. You try to send to some hospital, some medical college, or the person who is designated to. I will show you. I'll put it in the this thing WhatsApp group, whatever it is the medical college has. After the complete. Now this is the Thursday, 5 days gone. He's recovering because he could not. This height bed he cannot sit. So his first 2 days he was sleeping in the bench for blood transfusion in my thing. Then after operation we put him in the bed. Now he is going with a load like this. He cannot squat in the going for a potty. At least what with God's blessing, I have relieved him of the handicap, the sexual handicap, and also the load he was carrying. Day to day, he was having problem. No one taught me plastic surgery. I don't have any training in a hospital. I told you the previous day. But I took a skin graft from here and reconstructed his penis. Now this is the foundation. This is the basic course. A good MBBS, I want you to come out as a good MBBS. Not honors and this thing, okay. If you can, you must target. But if you feel that, no, I would say you get 60% and pass out, a good MBBS. Because answering a paper or answering the viva table is a matter of some luck also. If you have studied, then luck will favor you. But if you are blank, if you are point blank on the thing, when you are asked to hold the humerus, some of your friends told me, "Sir, humerus ta ki bujhte parchi na, korte parchi na." You see, read. If you have a language problem, you can, if anyone has come from a Hindi background or Bengali background, there are books in regional languages. You purchase that. Aapka, this bone sacrum. If you are asked what is this, you are saying sternum. And sternum, no, out of these 4 batches, there are some people who answered. You are the 5th batch, the glorious 5th batch. 5 years MBBS, 1 year's internship. So you are the glorious 5th batch of Santiniketan Medical College. Please don't waste your time. I have been wasting time, and I must take a shapat, Sharak shapat, that you will be going under. Pressures will come and all. So I think I'll be slowly by 26. I'm losing interest. I'm losing interest if you don't study, if you just look blank, you're not, I'm giving you the, I'm the traffic, Calcutta police traffic, okay. In Dharamtala, I'm standing on duty. So, okay. And in Delhi, one Rashtrapati Bhavan, there was one police band. He used to dance and give signals, you know. Okay. Now, I am that person. So, please don't waste time. You have the facilities. You have an AC room that is not running today. Not running means we have not put on the switches. Please go, 10 of you, or how many people are there, please now on next day. Next day what I will do is that you, if you don't bring your book, I will put you out. This is a parotid gland, right and left, whatever it is. Okay. Now, this is salivary gland. Salivary gland. Are khata gulo rakh na, rakh, relax, relax. Oof. You have to cultivate this habit. Now, this is the parotid gland. Now, these are the connective tissues. Now, it is all small, small lobular, that you are, what you've seen in the section I told you. Now, these connective tissue, they separate into some, like when you see in the, under the microscope, then what you will see? Maldives Island. And in our south, where, what island? The small island is a tourist destination. Huh? Okay. Now these islands you will see. And it is separating by the collagen fibers. Okay. Now it goes, now this today you won't see the parotid, but you will see salivary glands, I think it's a submandibular or something. Now, you see, you just inspect. These are the fibers. Now you can see this. If I take a small piece of the portion of the tissue and make a section, then what it will be? It will be like this. Now, if the, just to build up the concept, now that this small. Now, if it doesn't have a support like the concrete pillars, then the brickwork, this is giving the support. Similarly, it all gives support. Okay, in between any organ is to be supplied by blood vessels. Okay, and drained by the veins. Now, what you will see, there are 4 slides, 5 of you in each slide stand. Open a book. I have 2 atlases in one table. You keep one atlas, another atlas, and see this view. And you just have to now you see this. देखो, चलो. You see, you will see there, similar, this you will see. See, this serous salivary glands. Now, connective tissue septum, serous acini, intercalated duct. Now, তুমি দেখো এখানে এইরকমই দেখতে পাবে, এই যে তোমাদের যেভাবে করতে হবে, আমি এই স্লাইড দেখে তোমরা একটা এরকম করে দেবে। এই বই থাকলো, তাহলে তুমি আগে এরকম একটা now interlobular, I'm using the connective tissue, the connective tissue separating into lobes. Interlobular, okay. Now it has a interlobular duct here. You just draw like this. Okay. Now you see the serous acini. Over here you just and this has a basal nuclei. See the basal nuclei. Just draw in one.
Sir, একবার তো cuboidal salivary show.
Basal nuclei. Now you see, and this is the interlobular ducts. This is a lobule, this is a lobule, this is a lobule. There is a duct. Okay, interlobular duct. Label like this. This is acini. Okay. Now these are the collagen fibers. See, you will see some now you just see. So hold like this and you go on. If you view all the 4 slides, it is taken from the same block. It is not different blocks. And some you will be having some blood vessels, and you see each individual cells. You can, in between there is some blood vessels where red corpuscles are there. See, you just view and see there is one, right, if there is a RBCs are red, then this is the blood supply. This is the your interlobular ducts. These all ducts come and then join the major duct. Dakho. You draw rough. ওখানে একটা আছে, ওখানে মাইক্রোস্কোপ আছে। স্লাইড দেখে নাও, ওখানে দেখে নাও। একই ওটা মুভ করো। এই তোমার তো স্লাইডটা দেখো। You do see, এই দেখো। এই দেখো। See. It is taken from the one block. It is not from different tissue. It's one block. The tissue is cut into 4 slides. আমি কি বলতে চাইছি, you have your textbook, you see, and then you after, because you get 10 minutes, 5 minutes, whatever. Again, you have to review. You go and come and see, because you have still 1 hour. Now you have 15 minutes. You see, go and sit down, because this 1 hour don't lose loitering. Gola ghar and one sip of some fruity. Don't do it. It will be there. In the evening you enjoy a kebab or whatever it is, but আমাদের সময় তো এগুলো ছিল না. Our breakfast was this bread, one boiled egg, we have to the canteen, and chole ghugni. Bas, finish. But you have to change with time. Definitely, it is good to have good food. But what you make your this thing, we are eyes, mind, brain, everything you in focus.
Sir?
That operation, I took a skin graft. I got stunned. Few minutes, some minutes. I just took the same 3 pieces were of the same thickness. After a long time, I am performing this operation, but I have performed around 12 something like that, small, big, and all were successful. Now, this is the determination I have been planning, where I will make an incision, where I will this thing. I have been, the day I first see any patient, it might be appendix, it might be gallbladder, it might be hysterectomy, but I start planning from the very first day. I have operated and I don't remember how many patients. So you have to be very focused. না চলো চলো দেখাও তুমি ওখানে দেখাও if you want to adjust your fine this thing adjustment you can do this okay but it's very good slide
yeah it's very good that's
so you can see the even 1 or 2 blood vessels are there packed with RBCs it's packed with RBCs
yes sir
now after viewing no তারপরে তুমি যদি বইটা দেখো চার্ট একদম ঢুকে যাবে স্ট্যাম্পড তারপরে বাড়িতে গিয়ে খাতাটা আনবে 36 slides in 8 months you have to every day you do one thing I told you 36 slides এর আগে write up টা করে দাও the descriptive part you write salivary gland you write that descriptive part keep it today said you put in and then you add on the picture this is a shortcut nahi it is the technique I feel that though students are thinking that oh kya dekhega ऐसे बोल देगा किडनी किडनी नहीं है उधर दे दिया liver so you get prepared for it and 36 slides in 10 marks 15 marks you are going to get you have to histology so I am saying at the worst you will get 10 marks 10 marks it's a big volume to pass see nowadays it is not anywhere it will come and this it is very selectively it is mentioned that this is important for the exam even they are writing viva so that we didn't know in our time but you having 9 months I'm taking 9 months your illness your hachi your food your mela and all this and 9 months you have to cover up and you are asked to draw the humerus from the textbook then you draw but that's a practice if you have any if you are not good at art or drawing you just do simple sketches like this at least you can take a help of like this you draw okay now like this now like this okay now here's a tubercle intertubercular sulcus radial tuberosity now not really this is the now it is what structures passes through this what is the surgical leg what is this thing you just this head this lower end now it is the trochlear surface and now in the best thing to identify in your viva is your the olecranon fossa for humerus that looks backwards. I did it with head upore. You see right side, left side. And basic concept, the head will articulate with the glenoidal cavity to form the shoulder joint. If you 4 of you study together, not in a single room, seeing Netflix and all this and sleeping at 4 a.m., don't. Sometimes when you feel you start just sing or chitkar korbe. ঠিক আছে তো থালি বাজাবে whatever it is you I'm telling you, you're having many options, but study in groups your practicals. Histology. Then histology, again, when you are, hey, what structure passes through the intertubercular sulcus? You say 1, 2, 3, then he says, no, this, okay. Consult your book, reference book. Just don't fear, once the fear goes in, then you will create blunders. And whenever you are having time, when your thing is gone down, see it is, you have still, why I'm telling you to bring the book, you see at least the words which are the class teachers telling you. In today's histology, whatever I'm told you, you just keep a reference. That is, the primary glands are 3 pairs, okay. Secondary, the mucus and the oral cavity, oropharynx and all this. The tongue, these are von Ebner's glands. This secretes mucus, and your that 10%, and 90% is these 3 paired glands. Parotid, salivary, and your submandibular. Okay. Now, in submandibular gland, it has a duct. Sometimes a patient comes with a swelling here because it might be blocked by a calculi, stone. Okay. Now, if there is a stone, then she has a chronic. But if you say, now it can be a malignancy also, even if some adenoma in the parotid. Now you take a fine needle aspiration cytology. You do the sialogram in your submandibular gland. Sialogram, that is the duct, you inject dye, and that you take a radiograph. Okay. Now you will be having, don't order for an MRI or CT like that, because it's not essential. But for growth in the parotid, you go for a CT or MRI to see the type. And fine needle aspiration cytology. So fine needle aspiration cytology, if there is a growth in the your parotid, you are doing a fine needle. Now that how much tissue is there? Okay. Now you take from 2 different sites. So one you put in this side. Like if there is that thing, you put in one side and then you go. And then another from this side. Because the tissue that is spread is that you think the diameter of the needle. Okay. That much of tissue is sufficient to do histopathology. So you have to know the basics, and you can automatically don't panic. Khana, breakfast, honey, dry fruits in the morning. Chalo. Next, bolo. ঠিক আছে?